2 a.m. You're half asleep, your little one is coughing, and every search result feels like a new worry. Tonight, we're going to give you 3 kitchen-friendly, clinician-vetted comfort tools you can try safely and know exactly when to step back and call a doctor.
Hi, everyone. I'm Fiona. We're keeping this safety first. Exact age cutoffs, clear red flags, and printable safety cards in the show notes. We'll also share low-cost swaps and multilingual cues so more families can adapt these ideas tonight.
I'm Sam Ning. Listen, caregivers, start small. We've invited 2 clinicians to guide us, Dr. Mira Patel, a pediatrician, and Lena Huang, a pediatric-trained clinical herbalist. Welcome. Thank you both for being here.
Thanks for having me. I love that this episode is framed around safety. Families need practical steps that don't replace care, but can ease a child while you figure it out.
So glad to be here. I'll focus on kitchen doses and swaps, things people actually have at home. And I'll keep it simple, so parents feel confident to try them safely.
Cold open over. Now, quick promise. By the end, you'll have 1 doable ritual to try this week, plus the safety cards and a 3-day tracker in the show notes. Fiona, let's set the triage table. What should every caregiver check first?
First, the big non-negotiable red flags. Difficulty breathing, blue lips or face, high fever that won't come down, severe lethargy or not waking to feed, signs of dehydration, or signs of anaphylaxis like swelling. If any of those are present, stop home care and seek urgent care.
Exactly. Age matters too. Honey is off the table under 12 months because of botulism risk. No exceptions. Also check allergies before introducing anything new. Family history of allergic reactions, known food allergies, or prior wheeze with foods.
That honey rule always catches attention. No honey under 1 year. Lena, for families without an allergy history, what's a quick patch test parents can do when trying a gentle food remedy for the first time?
A simple patch test is fine. Give a tiny taste, like half a teaspoon of the new ingredient, and watch for 20 to 30 minutes for hives, swelling, or difficulty breathing. If anything unusual happens, stop and call your pediatrician. And always introduce 1 new food at a time.
2 other quick safety notes. Check current medications. Some herbs can interact with common prescriptions. And if your child has ear tubes or chronic lung issues, skip steam or be extra cautious with saline techniques. We'll list contraindications in the show notes.
Great. Let's move into the herbalist side. Lena, you map out culinary doses and low-cost swaps. People worry about measurements. What's a safe, kitchen-friendly approach?
Teaspoons and tablespoons, fresh or dried forms that are commonly used in cooking. For example, chamomile, as a tea. 1 chamomile tea bag or 1 tablespoon of dried flowers per cup of water. For lemon balm, a teaspoon of dried or 1 fresh leaf steeped. Avoid concentrated extracts for kids unless a clinician recommends them.
From a nutrition and safety standpoint, that culinary threshold matters. We're not using medicinal tinctures or high-dose supplements. These are food-level uses with known culinary measures.
Okay, let's give families a quick prep checklist before our demos. Fiona, Lena, what's on that 1-line checklist?
Check age cutoffs, check allergies and meds. Gather 1 cup of water, a small pot, a mug, and the ingredients for each demo. If you don't have fresh herbs, dried can work. I'll say specifics before each demo.
And have a thermometer and your pediatrician's number handy. If you're improvising because you lack an ingredient, use our swaps in the show notes rather than guessing. There's a safe alternative for most items.
Demo A, Sleepy Sip. This is for 12 months and older. I love this one. It's gentle, warming, and creates a small ritual before bedtime. Lena, walk us through the ingredient list slowly so listeners can write it down.
Ingredient list for 1 child-sized cup. 1 cup 240 milliliters water. 1 chamomile tea bag or 1 tablespoon dried chamomile flowers. Half to 1 teaspoon dried lemon balm or 1 small fresh leaf. Half a teaspoon raw honey, only if the child is 12 months or older. Optional, a pinch of cinnamon for warming flavor. If you prefer, maple syrup works as a honey swap for older toddlers.
Quick note. Chamomile can rarely cause allergic reactions in people allergic to ragweed or other Asteraceae family plants. Patch test if you're unsure, and watch for any hives or breathing changes.
Step by step now, slow and clear so caregivers can follow while they make it. Step 1, pour 1 cup of water into a small pot and heat to just below a boil, so you'll see tiny bubbles at the edge. Step 2, add your chamomile and lemon balm, then turn the heat down so it simmers gently.
Step 3. Let it steep over low heat for 5 minutes. You'll smell the floral notes rising. That aroma is part of the ritual. Step 4. Turn off the heat and let it sit for a minute. Step 5. Strain into a mug and let it cool until it's warm but not hot. Step 6. If age appropriate, stir in half a teaspoon of raw honey or a little maple syrup. Offer it calmly, no force. Let the child sip slowly.
Sensory moment. Hold the cup together. Breathe in the steam with your child. Let them feel the warmth in their hands. That ritual, that pause, signals safety and sleepiness.
Timing and frequency. 1 small cup, 15 to 30 minutes before bedtime, and no more than once per evening for ritualizing. If the child is on sedating medication or other specific meds, check with your pediatrician first. Some herbs have mild sedative effects and can interact.
Common mistakes to avoid: don't serve it too hot, and don't use honey under 12 months. If the child coughs persist or breathing worsens, stop and call your clinician. Bridge, quick prep for Demo B. We'll make a gentle saline and show safe steam alternatives. Fiona, why do caregivers reach for saline or steam?
Saline helps clear nasal passages and improves comfort. Steam can ease congestion, but must be done safely. We're going to emphasize a low-risk, effective saline and alternatives that don't risk scalding or airway issues.
Never use homemade menthol products on an infant's face, and never put essential oils in a child's nostrils. For steam, avoid hot baths with a child's head over hot water or steam inhalation practices that risk burns. We'll offer safer options. Saline recipe for infants and children. 1 cup, 240 milliliters, boiled then cooled water. Half a teaspoon non-iodized salt, like sea salt. A pinch of baking soda if you have it to buffer. Mix and store in a clean, sealed container up to 24 hours in the fridge. Use a bulb syringe or a gentle nasal aspirator for infants. Older kids can use a small syringe without a needle to apply a couple drops per nostril.
Demonstration tips. For babies under 1, place them slightly upright, support the head, and put 1 drop at a time in each nostril. Then use the bulb syringe gently. For toddlers who resist, make it playful, a silly blow-the-pirate game, or have them look up at a favorite toy while you do a quick rinse.
Contraindications. If the child has prior ear surgery or chronic ear disease, be cautious with nasal suctioning and consult your ENT or pediatrician. If there's blood in nasal secretions or symptoms worsen after saline use, stop and call your clinician.
Safe steam alternatives that don't risk scalding. Use a cool mist humidifier in the child's room while they sleep, or sit with them in a warm bathroom with the shower running hot. Close the door to create a humid environment, but keep the child a safe distance from hot water.
Another low-cost option, place a steaming pot of water on a low heat across the room, out of reach, so the ambient air is humid. Or drape a towel over a warm shower head and let steam fill the bathroom. Always supervised, and never place an infant directly over a pot of hot water.
Demo C. Soothing soft porridge or broth for mild tummy upset. This is about comfort and gentle nutrition. Lena, read the ingredients slowly.
Ingredients for a small child portion. Half a cup, 120 milliliters water, or low-sodium vegetable or chicken broth. 2 tablespoons rolled oats or rice porridge rice. 1 teaspoon grated apple or mashed banana for taste if tolerated. A pinch of salt if using water. Optional, a teaspoon of cooked carrot or squash puree for nutrients. For dairy-free needs, omit dairy and use water or broth. For egg allergy, skip egg-based additions.
Nutritionally speaking, this is about easy-to-digest carbs and gentle hydration. Avoid spicy or fatty foods when the tummy is upset.
If vomiting is frequent, call your pediatrician. Don't try to force solids.
Step-by-step porridge. Step 1. Combine half a cup liquid and 2 tablespoons oats in a small pot. Step 2. Bring to a gentle simmer. Stir often to avoid sticking. Step 3. Cook for 5 to 7 minutes until very soft. Step 4. Mash or blend with the grated apple or mashed banana. Cool to warm and offer spoonfuls slowly. For tiny mouths, serve a tablespoon at a time and watch tolerance.
Storage. Keep leftovers refrigerated for up to 24 hours. Reheat gently, and if reheating in a microwave, stir well and test temperature carefully. Frequency. Offer small amounts every couple of hours, rather than a full meal until appetite returns.
Short cross-cultural comfort segment. Fiona, Lena, share one comforting ritual from your backgrounds and a quick note on why it works.
In my family, we made ginger tea porridge for mild nausea. Very diluted ginger and rice cooked together. It's warming, easy on the stomach, and the motion of feeding felt like care. For kids under 1, I'd adapt by using just a hint of ginger in the parent's portion or the older child's cup, but never give ginger to an infant without checking the clinician guidance.
My family often used plain congee with a small spoon of cooled broth. Hydration plus gentle calories. The science behind it is simple. Bland, warm foods are easier to digest and provide some electrolytes if you use low-sodium broth.
2-minute myth bust. Myth 1. If it's natural, it's always safe for kids. Not true. Lena, quick take?
Natural doesn't equal safe automatically. Chamomile and other herbs can cause allergies, and concentrated herbal extracts are not the same as a kitchen tea. Always use culinary doses and patch test when in doubt.
Myth 2. Steam inhalation is harmless. Not true for small children. Steam can burn and worsen symptoms if misapplied. Use cool mist humidifiers or supervised bathroom steam alternatives instead.
Segment on involving kids and accessibility. Small ways kids can help without medicalizing the moment. Simple tasks like choosing the mug, pressing the honey spoon for older toddlers, or playing a calming song. A child's participation makes the ritual feel like something they own.
For resource-limited families, swaps include using warm water and gentle massage instead of specialty herbs, or plain oats instead of packaged baby foods. Multilingual cues will list in the notes, simple phrases like sip slowly or blow your nose in several languages, so families can use familiar words with children.
Before we wrap, Dr. Mira, please restate the absolute red flags caregivers should never ignore and when to get urgent help.
If your child has trouble breathing, noisy or rapid breathing, blue or pale skin, very high fever not responding to fever-reducing measures, unresponsiveness, severe dehydration, or suspected poisoning or anaphylaxis, call emergency services immediately. Also, if a baby under 3 months has a fever, seek care quickly. These remedies are supportive, not replacements for urgent care.
We want to leave you feeling capable, not overwhelmed. Try one demo this week, maybe the sleepy sip, and notice how the ritual feels for your family. Small, consistent steps make a difference.
Resources and safety cards are in the show notes. Clinician-reviewed safety cards, a 3-day symptom tracker, and multilingual cue sheets. Use those. They save mental bandwidth in the moment.
Thank you, Dr. Mira and Lena. To our listeners, try one of these rituals tonight. Take care and remember, your body knows, your care matters, and small acts help. We'll be back with more practical, natural tools.
Thanks for having me. If you're ever unsure, err on the side of contacting your pediatrician. Quick questions can prevent big worries. Thanks. Gentle experiments, clear checks, and community support. That's what I hope caregivers take away.